So hi everyone, thank you for tuning in. For those of us who are new, my name is Stacey, and for those of us who have already subscribed to the channel, I want to say thank you for joining me again. Another time where we will be discussing, all about nursing. As promised, I'm gonna go in a little bit more detail regarding my transition process from Jamaica as an international nurse with a recruiting company. But before we do that, I'm gonna have you subscribe to the channel, turn your notification bell on so that way you can be alerted of my newly released video. And if you've already done so, no worries, just go ahead and drop a comment below, a like, send it over to a friend so that way they can actually be a part of this platform. Yes, go ahead and do that. So as promised, I'm going to be discussing my transition process with a recruiting company that is based in Florida. And if you need to hear a little bit more detail regarding this company, feel free to send me a message, and I will tell you a little bit more about the company that I use. All right, so this recruiting company is based in Florida, and at the time in 2013 and 14 thereabout, when I signed my contract, I initially had sent a message over to the company on their website, and the following day they responded and they decided that they were going to call me to get some information regarding my inquiry into the program. So at that time we had a little bit of a discussion, and then they requested that I go ahead and do a resume. I tell you, it's going to be the longest resume you've ever done in your entire career, even if you've only worked as a nurse for 2 years, 1 year. It's going to be very lengthy because what the requirement for the resume entail is not like the regular resume that you would normally say, oh, you work over this place, you left at this time, and this is the system that you use. No, it's going to be a case where for every job that you've ever worked in, they want to know what your level of competence is with different age group conditions, what bed count was like at the hospital, like how many beds they had, medication wise, what kind of medication you've been exposed to, and if you're comfortable with it. So it's a very detailed resume, and I understand that it is going to be very important in terms of them having a better idea of what area you have a little bit of a weakness in versus an area that you're more competent in whenever they are trying to get you a job. So then we went on to the contract. So the contract is where you have your terms of agreement. This is where your rates will be. It will also highlight, so for example, you decide that you want to leave the company. It will tell you like how much you would have to repay, the terms of the contract, how many hours you need to do in order to fully sign on or to call your contract, completed. The package came via FedEx directly to my house. And at that time, it included audio files. There were books as well, and then you had subscription services later on. And all of that is in preparation for the exam. They decided to do weekly exam with us, and depending on how you're scoring on your exam, then they will decide if you need to take a little bit of a longer time, or they can actually book your exam earlier than expected. When you're trained in another country, going into a first world country, there is going to be a totally different way how you manage certain condition or how you deal with certain patient. Preparation is going to be very, very important, because if you've worked as a nurse before, you've had experience, it's going to be a difficulty when you're trying to sit that exam, because in the back of your mind, you'll be sitting there thinking about, oh, you have a patient over there coding, you have 30 patients to take care of, and it's only 3 nurses on the floor. So you're thinking of all the situations or the scenarios that you've encountered working as a nurse, and then you're thinking about the question that is in front of you, and then there's a high possibility that you choose the wrong answer. Versus if you have just graduated from nursing school with lack of experience, then you might be thinking just as the textbook is saying, you're not critically thinking and analyzing the situation, and so you'll just choose the exact answer as what the textbook would have said, which would have been on the paper. And so there is going to be a lot of emphasis, focus on trying to make sure when you're studying, you are not studying and answering the question as if you are working in the real world in another country, in Jamaica, in a country that has little resources. You have to focus on the question and just think of the question as is. You have all the resources in the world. It's the perfect environment. You're not short-staffed. You don't have a situation where you don't have the supplies for it. All of that is available. And so you have to refocus your mind into thinking that you're not working in Jamaica, you're working in the real world when you're doing your exam questions. And so the company is gonna use that information to say, okay, then if you're scoring 60-70% on your exam, knowing that you are following, exam protocol, then they will feel a little bit more comfortable with you getting to do your exam at an earlier date, versus if you are scoring 90%, 100% as an international nurse where there is a lack of resources and all, they're going to know that you are not ready, because even though your scores are saying this, given the fact that probably they have had experiences with nurses scoring high on their exam and failing, they're going to put you in that category to say you're probably not ready for that exam. Just be mindful of your grade, focus on the exam questions, and just think of the perfect world when you're answering the questions, so that way you can progress quickly into getting your exam done. And then the other thing is focus on your areas of weakness, because during that time period, you will be able to identify which area you're not doing well in and refocus and do more questions to target that area to better your outcome for your exam. All right, so after we did that, they encouraged me to continue doing my normal work hours. At no point they decided that, because you sign a contract or anything, you're going to be cutting down your work hours or resigning your job. They will tell you from the initial that the whole process from the time of signing your contract to getting into the US takes roughly 1 year. And that's exactly how long it took me before I got into the US. Exactly 1 year. The steps that I had to take, preparations and everything, lasted for exactly 1 year. So you're studying for your exam, working in your country. During that time, the company would have already requested numerous documents. So you just have to make sure you're on top of things with getting those documents sent over, checking your email constantly, answering your calls whenever they call. So that way your process can be easy, and it's not a case where you have a lot of things outstanding. CGFNS is a body that actually evaluates your nursing education as an international nurse. It also evaluates your secondary education just to make sure you have met the criteria. And it also evaluates your nursing license to make sure you don't have any issues or anything, and everything is up to standard with the international license. Once all three of those are, everything comes back good with those checks or the evaluation or verification process, then they will go ahead and approve you for sitting the NCLEX, which is the exam that you will do as an international nurse, or the exam that you will do as a registered nurse trying to work as a nurse in the US. All right, so once you do that, then they will go ahead and send you an email, which is the authorization to test. And that email is going to be very important. You have to check your email very regularly, because that email is the one that you're going to use to go ahead and book the exam, the NCLEX exam, at a testing site. The company, my recruiting company, they use a Peer-to-View testing site, and that is based in Florida. They're based all over the country, but because the company is based in Florida, they use that. They also do testing in Mexico. So just in case, you might not get through with a visa for the US to come and sit your exam, then probably Mexico is the next best option that they will give you to go and do your exam. All right. So after you get your authorization to test, then they will go ahead, the company will go ahead and book your exam. Back to the exam. The exam is 165 questions, multiple choice questions. It is 3 hours of testing time, and it is computer based. All right, so after you've received your authorization to test, and you send it to the company that you're working with, you send it over to your recruiting company, then they will go ahead and book your exam. At this point, you're still not paying any money out of pocket, because the recruiting company is doing everything. And that's a good thing about having a recruiting company, especially when they cover the cost for certain things. It made the transition or the process easier for you, because sometimes you might be sitting down and having issues with, certain amount of money to pay for so for example, an exam, or just even some simple stuff. You might have a difficulty paying for that. The recruiting company is there, and because they have resources, they have money available, they can go ahead and do that. And then later on, you'll pay them over time by working with them. And that's the good thing about the recruiting company. And so this recruiting company, they went ahead and booked the exam. They also booked my airline ticket. They arranged for hotel stay. So depending on where the exam was going to be, they arranged for pickup, hotel stay. The only thing I was responsible for was food, and they did all the transportation back and forth from the testing site to the hotel, and then back from the hotel to the airport after you're finished with your exam and is to return to your home. They will send you an itinerary to see exactly what is going to happen each step of the way. Your responsibility in your country is to go ahead and figure out how you're going to get from home to the airport. And if that's something you're having an issue with, I don't know what to tell you. But try and figure out how you're going to be getting from your home to the airport in order to get your exam done. That's the only thing you need to worry about at that time. Otherwise, every other expenses is covered by the company. All right, so as I say, they'll send you an itinerary with every single detail regarding the travel. So don't feel as though when you get into the US, you're going to feel like, oh, you don't know what's going to happen, or, probably you're going to go in the wrong taxi, or you're going to be going to the wrong location. No, they are so organized that they send you an itinerary with names, vehicle color, or detail that should be on the vehicle. So that way, when you're standing, you can be very comfortable standing and waiting for your vehicle without asking a passerby, hey, do you know where I can find this, or do you know where I can find that? No, they arrange every single thing down to detail. Right, so on the day of the exam, the company will arrange for transportation back and forth, pick up after the exam is finished. They tell you who to call, take you back to the to your hotel, and then you travel back to the country the next day. If it's a pass, it's a P. I think if it's a fail, it's a F. I've never failed it before, so I can't really confirm if it's a F, but I'm just assuming. So the only thing you need to see is a P. But I want to say, just study. Make sure you're studying and focusing on the questions, focusing on, the real world, and not what you're doing in your country in order to get that P for pass. Yes, nobody wants to do an exam twice or 3 times. The company will pay for your exam at that time. And then if you fail it, the Lord forbid that you fail that exam, all the cost associated with getting a retest, arrangement for hotel, transportation, and all is going to be on you. Yeah, you don't want that and then having a big contract to think about as well. No. You've passed the exam, then it's now time for you to actually try and get an interview and get a job in the US. During this time, the company still advises you not to resign your job, not to quit your job, continue working your normal hours until a job is secure. It's not a matter of you have to get a job from your country, because I've seen where persons get a job when they arrive in the US, so because after you get your immigration visa, there is only a certain time period that you remain in the country. After the exam, they went ahead and filed for immigration visa. During that time, you would have already sent in all the documentation and you'd have gotten your scores. Now you have a reason to apply for a green card to work in the US because you have a sponsor, which is a recruiting company. So they went ahead and sent in all the paperwork. I went ahead and paid for, I think there were 2 things that I had to pay for, but it's on their website. There's a lot of things that you will need to cover in terms of costs for the immigration. If you have children, a spouse traveling with you, then you'd have to cover all of those costs associated with that person. So after you've been successful on your exam and you've been successful on your interview, now is the time to start your immigration process. As I say, earlier on, you would have gotten all of your documentation over to the company and they would have started the process. They're just waiting for you to actually, do your exam, be successful on your exam, so that way you can actually apply for a job to work in the US, because you'd have already have a license, which is your RN license, the exam that you just did for NCLEX to work in the US. In the meantime, what I would advise is for you to go ahead and get all of your vaccines up to date. Whatever vaccines you can get, go ahead and use it. Some persons have free healthcare in your country. Go ahead and get all the vaccines that you can get, so that way whenever you go for your interview, which is going to be 2 weeks. So you're going to do a medical interview, and that is going to be 2 weeks prior to your interview date. You'd have had all your vaccines up to date, and then probably 1 or 2 vaccines, which you probably would have been harder for you to receive then you will be able to get them at the clinic or the hospital or wherever they send you to get your medical done. That cost is going to be out of pocket, and that is going to be on you. It's not going to be the company that is going to be covering. So after you've done your medical, you go in and do your interview. They'll ask you a few questions. The company would have sent down a bunch of paperwork, and they'll tell you, do not open this package. It is information regarding probably tax documents, all of the information for your processing of your green card or your visa. And once you go up there, you hand that to them, and then they will take it, do whatever they need, ask you a few questions, just make sure you know the answer to the question. If it's a case where they're going to grant you your visa, they will go ahead and cancel your 10-year visa and give you like a 90 days or 60 days. I think it's 90 days they'll give you on your visa. Once you get your 90 days, that means you have 90 days to stay in the country, your country, before you actually leave to the US. After 90 days, the visa that they've now approved you with expires. So you have to be in the country during that time. It is at that time the recruiting company is going to encourage you to go ahead and do your resignation. You'll be doing interviews. If you haven't gotten an interview, they will try to get interviews still going, because now you've been approved your green card. So we'll go ahead and try to get interviews going. And the most important thing is to make sure you're doing well on your interviews, because companies will prefer someone who is already in the country versus someone who is like, thousands of miles away, not able to probably start in like 2 weeks time or so. So you want to make sure that you're doing well on your interview, so that way you can get a faster time in terms of getting into the US and then starting your work. So just make sure you're doing that. And so they will guide you as to when to send in your resignation, and how to go about doing it, what you need to do, get a letter, sign off, or get a copy of the resignation, sign and stamp off to say that it was done appropriately, because you don't want it to be a case where, years from now they call the hospital for a review or recommendation or something, and then you hear that, oh no, she never really gave us any time off. She just get up and walk off and be like, bye-bye Mandeville Regional, bye-bye Jamaica, and then she just jump overboard. No, you want to make sure you're doing it professionally. You want to make sure you're doing the right steps, because try not to burn your bridges. Do not do that. Do not burn your bridges, because you don't know what can happen years later. All right. So they will tell you when to go about doing your resignation, and then from there. So after you've sent in your resignation letter and all, the company is going to decide on when you're going to be moving to the state. And at that time, you will be going into Florida at the company, the recruiting company. They have like apartments where they house their international nurses, and then they will go through like a 6 weeks program where we will go through a lot of things in 6 weeks in preparation for your new job in the US. As usual, the company will go ahead and do all the booking, costs associated with, the flights, the arrangement to the hotel that you'll be staying, or the apartment that you'll be staying. The company will go ahead and do all of that. Once you're in the US, at the company's headquarters, you will go in and you will do like a 6-week transition course or period. You'll be doing modules that are, associated with probably wherever you'll be working, like your BLS certification, PALS, TNCC, ENPC, so different certifications related to your nursing area. Courses, you'll be doing that. If you need to do additional courses, they'll get that done during that time period. They will go ahead and help you with purchasing a car or leasing a car, your insurances, getting your car insurance, setting up a bank account, setting up a credit union account, applying for a car loan, applying for a credit card, apartment leasing options. They will do all of that with you. All right, so they will go through a cultural transition class with you as well, where they will kind of highlight some of the things that are different, so that way when you get into another state, you're not going to be like, oh, hold up, what's going on? Well, that kind of caught me at one point, because when I went into Maine, it was a case where the person was like, okay, you're here and this is your patient. All right, no problem. I'm going to put patient in a gown. And they're like, what? What's a gown? And I'm like, a gown? Like the clothes that you put on when you're in a hospital? Oh, a Johnny. And I'm like, oh, Johnny. I've never heard it like that. But yeah, different cultures do different things. They say things differently. And so that is something that you have to get used to. So they will go through all of that during that time. And when it's time for you to actually move to your state, where you'll be working, they will have somebody accompany you. And because you've already done your apartment search, purchasing your car, you have your insurance and all, then when you get into the state to pick up your car, there's somebody there to pick you up from the airport and then assist you with getting to your apartment, getting your car, shopping for your apartment, going over to the hospital to do like a one-on-one or just high and by kind of situation with the staff over there in preparation for you to start working whenever. So this person that is assisting with your transition is called a transition specialist, and they are in different parts of the country, assisting new persons or international nurses with their transition process. They spend probably like say 2 or 3 days with you, have a meal with you, see how you're feeling, hear your views a little bit, help out with your transitioning process to make sure that everything is going to be smooth whenever you start working. And if you have any questions, then you can always reach out to them. And the process was very smooth. You have a lot of support system, a lot of persons you can talk to. You can always reach out to them regarding a particular issue, and they will be like, responding in a timely manner. That was a good thing about them. As soon as you call, you might have a little bit of a wait time, but it's not going to be that long. And you can always talk to them regarding any issue that you have. So I find the process very organized. This recruiting company, I would give them 10 out of 10 any day. It was a smooth transition. Everything that they said is what exactly they did. As I said, the only problem I had was that the money, it wasn't that much, but it's workable. You just have to make sure you look at certain things, take certain things into consideration, and I will do a video on that, some of the things that you need to take into consideration before signing a contract. So yes, you just need to take certain things into consideration before signing a contract, because everybody's situation is different. So not because I'm single, you're single, it doesn't mean that we're going to be in the same situation. No, everybody's situation is different because everybody have their family life that they need to deal with, personal issues that they need to deal with. Make that decision based on all of those factors before signing your contract. So that way you can have a smooth transition and it might not be, overwhelming or a saddened situation for you when you get here. So I do hope that you enjoy the video. I will give you a little bit more information regarding insurances, apartment rental and leasing, or car purchase in another video. But if you have any questions, as I say, feel free to leave them in the comments below, and I hope I will be able to answer them. At the same time, I still would love for you to like, share, subscribe, turn that notification bell on. And if you know anyone that is interested in this platform or in this topic or transitioning, just want to know more about the whole transition process for international nurses, then have them go ahead and subscribe to the channel where we can all discuss all about nursing. Thank you for tuning in, and I'm happy that you're here. Bye.